Hello, my name is Tom Harrod, and I'm the Associate Director for Reference, Instruction, and Access at the Himmelfarb Health Sciences Library. Thank you for joining me for this first video in a 9-part systematic review seminar series. The goal for this series is to describe the process of performing a systematic review, going step by step from the development of a research question through the creation of a manuscript. Systematic reviews are complicated and involved projects, which typically take a team of reviewers, sometimes many months, but typically over a year to complete. Therefore, it would be impossible to cover all relevant topics in this series, so the coverage will necessarily be somewhat shallow, but I hope it will be at least enough to give you a flavor of what's involved with one of these projects. On this page, you can see a rundown of all the topics to be covered, including the topic for this session, which is types of reviews. On this diagram, I show some of the categories of literature reviews that one can perform. It's important to understand this as it helps to have shared expectations, meaning when discussing systematic reviews or scoping reviews or traditional narrative reviews with people, it's important to make sure that you mean the same thing when you are referring to these different article types. Some people use the literature review and narrative review terms interchangeably, but for the sake of clarity, I'm going to use literature review as an umbrella term to cover all of these subtypes. But different people use these terms differently, so my point here is to encourage people to make sure they have a shared understanding when discussing these kinds of articles. Narrative reviews are what we often think of when someone says literature review, as opposed to systematic reviews, which are the topic of this seminar series. Within systematic reviews, there are many subtypes, including scoping reviews, systematic reviews of qualitative evidence, rapid reviews, and many more. In this chart, I'd like to distinguish two of the most common types of literature reviews, the traditional narrative review and the systematic review. The first area of distinction between these two is in terms of purpose. A narrative review is typically intended to give a summary of a topic, to identify the most important information and to summarize. This can be very helpful for readers who are new to a topic and need to quickly be brought up to date. As opposed to a systematic review, which is usually intended to answer a specific question by collecting all pertinent information on a topic, synthesizing the results, and arriving at an answer. In medicine, the questions which are the central focus of this type of project are often clinically relevant ones around diagnosis or treatment, with the goal of informing medical practice by presenting a composite answer that takes into consideration all available data. In terms of time, as I stated before, systematic reviews take many months and more likely more than a year to complete. That is because of the very involved methodology involving a team of reviewers who are painstakingly collecting and extracting all relevant evidence, as opposed to a narrative review, which may be completed in a much shorter time frame. The methodologies of these reviews are very different. For a systematic review, there is a consistent, methodical, and exhaustive series of steps required to ensure that the project is done correctly. It all needs to be well documented, as the methods section will be included in the final manuscript. For a narrative review, the methodology is a lot looser. These articles typically don't report on methodology, in fact. The search strategies are very different as well. For a systematic review, multiple article databases will need to be checked, as there is no one database that is likely to contain all the relevant articles. In addition, alternate information sources beyond traditional article databases may need to be checked, as not all relevant information will be found in published peer-reviewed journal articles. The process of selecting articles is also very different. For systematic reviews, there is a well-defined and tested inclusion-exclusion criteria that are applied by all reviewers to minimize the chance of bias within the project. Whereas for narrative reviews, the choice of articles is largely left up to the individual discretion of the authors, which may introduce some bias into the selection process. The last element that I discuss here is protocols. Systematic reviews are typically performed based on a predefined and sometimes registered protocol, which gives a roadmap of steps that the authors will take to ensure that their process is inclusive, broad, and as free of bias as possible. in contrast to narrative reviews, which typically are not performed based on a protocol. So to sum up, what makes a systematic review systematic is the following. They are methodologically rigorous, and they are also performed based on protocols with well-documented procedures, as the methodology will need to be reported when it comes time to write the manuscript. Additionally, these projects are meant to be an exhaustive search of all literature, done in such a way as to minimize the introduction of bias, and all of this performed based on accepted guidelines and standards. The next thing I'd like to discuss is the different types of systematic reviews. There are many different flavors of systematic reviews, and some of them are listed on this slide. The two that I want to focus on are the traditional systematic review and the scoping review. I mention these two especially as they account for almost all of the projects of this sort that I've ever been involved with. On this chart, you can see the growing popularity of scoping reviews during recent years. I looked up articles with the phrase scoping review in the title in the database Scopus, and you can see these were almost unheard of 10 years ago and have since surged in popularity. On this slide, I show a side-by-side comparison of systematic reviews and scoping reviews. One of the key things that distinguishes systematic reviews from scoping reviews is the purpose of the review. As discussed previously, systematic reviews are performed typically to answer a specific question. Scoping reviews, however, are typically done to describe the literature that exists around a certain topic, to provide a broad overview of the topic, and possibly to identify gaps in the literature which can be the subject of future research. Another difference is that while systematic reviews often include some kind of quality analysis of the included articles, that is almost never done in a scoping review. In systematic reviews, specific research outcomes are typically part of the search strategy, leading to a narrower but deeper search of the literature, as opposed to scoping reviews, which often don't specify research outcomes and therefore involve broader but shallower literature searches. Another area of difference is that systematic reviews often limit searches by article types. That is, they may only look at randomized controlled trials, for instance, in order to have a set of articles with comparable findings. Whereas scoping reviews often have no limits on the types of articles retrieved, as the goal is to describe all of the literature that exists around a certain topic. In conclusion, there are many different types of review articles, including narrative reviews and systematic reviews. I discussed the characteristics that make a systematic review systematic. They involve exhaustive, thorough searches done via a protocol following widely accepted standards that are intended to minimize the introduction of bias in order to locate all pertinent evidence on a topic in order to answer a specific research question. I also discussed the difference between systematic and scoping reviews. These both use similar methodologies, but with different desired outcomes. Thank you for watching this video. My email address is here on the screen, tph@gwu.edu. If you're a faculty member or student at George Washington University, please feel free to contact me with any questions. In the next session, I will be discussing Prisma, Cochrane, and other systematic review resources.